this is just what we've said, Zachary. Care is overwhelming when we are alone. Often we could be surrounded by medical professionals and even surrounded by extended family, and we still feel very alone because we're not sharing the burden of care. Zachary, does this ring true with you personally?
Yeah, this is this individualized model of care is something that in the Western world we kind of grow accustomed to and think that this is somehow normal and the best way of going about care. And what you and I really spend a good amount of time talking about in our book is the idea that this must be deconstructed, that this is not the best way to be a caregiver. This does not reflect the ways in which caregivers must care for their loved one. That is a remarkably private act, the acts of care with your loved one.
Mm-hmm.
But the ways in which you enact care and the care that exists around that is as important as what you do with your loved one. And no caregiver can exist apart from this idea that you're talking about in terms of help. And I think that the theme that I'm taking today is that when we talk about people, we're talking about people and help, right? And that's very different than resources because people have names.
Yes, they
and
do.
People have histories.
Yep.
And people have let us down. We've talked about that.
Yeah.
And people have disappointed us. And we can be rejected. And we can perceive life and others' responses to us differently when we are isolated, emotionally exhausted, and vulnerable. And I just wonder if our participants this afternoon, Donna, when we hear the word help, it's kind of scary, right? Because we think of people who won't help us, don't know how to help us, reject our help.
Or we think of only services.
Yeah.
We think of professionals, like in this individual model of care. It's the physician and the patient, because that is the medical model of care. And what happens at home is far sort of less important in terms of the hierarchy of power when we think about that. But, but the fact is that realistically, it's the primary caregiver and the patient that has the key, most important relationship there. And that's where you can feel so alone. Mm. And so if we move to the next slide.
Yeah. And, just a comment from Nicole Donna, as we go along here, she'd be interested to know from us or other caregivers who are parents, she finds it really hard asking for help to care for her daughter.
Yeah. Hi, Nicole. Yes, Nicole, we must talk about this. Both being parents of children with disabilities. And we are going to get into this today. Why is it so hard to ask for help? And how can you ask for help in a way that's easier? We're going to talk a lot about that. So, this network model of care is one that includes service providers and medical professionals, but it also includes what I call natural support, because I don't like this term that's often thrown around in caregiving, which is formal and informal, or paid and unpaid. I think that a term that works better for me personally is natural care or natural support. We have these natural relationships that we go through in our lives. Many of them are pre-existing relationships, and then caregiving, becomes a reality, a necessity in your life. And some of those people will step up and become forms of natural support, rolling into the normal day in ways that are very natural. So it's a mixture of the medical side and the personal side, and it becomes one whole ecosystem of care. Next slide. So in order to introduce the network of support and what that looks like, Tammy, I'm going to ask you to play a video that describes an online tool that is Canadian, and it's called Ties, but it'll give you a flavor for the kind of coordinated support network that I want to talk about today.
Can you see my screen?
We can.
Ties is an online tool that brings people together around someone receiving care. All kinds of people use Ties to manage health challenges. With Ties, you can easily keep everyone in the loop. It's simple and totally private and secure. People use Ties in a variety of ways. Ties users can update everyone quickly and easily, plan on a shared calendar, safely store important documents, and let friends and family know how they can pitch in. You can even share stories, photos, and messages.
Helping my dad manage his condition and everyday errands is tricky, and keeping everyone updated takes a long time. I'm already so busy.
Ties can help. Log into Ties to organize daily tasks and errands like rides to the doctor, and to put appointments in the shared calendar.
My mom doesn't want to overload any one person.
With Ties, it's easy to ask for help. Everyone can see what's needed and pitch in the way that works best for them. When we share the care, everyone benefits.
I want to keep my confidential information, like my legal, banking information, medicines, and passwords, safe in one place, but I want my family to have access to it.
Safely store your medical history, emergency contacts, financial and other legal documents privately and securely in Ties. It's safe, private, and uses bank-grade security.
My sister is a whole person, not a patient or diagnosis.
With Ties, you get to celebrate all the best parts of life. Share photos and updates on the care wall. Schedule events. Post pictures of your activities, grandchildren, whatever you want to share. You can also update everyone at once. No need to make lots of phone calls. To learn more, visit ties.com today.
So this is just an example of a tool, an online tool that is Canadian. And it's important, I say it's Canadian, because if you're thinking about building a network of personal support and coordinating it using an online tool, you need to have data storage in the country where you live for health record storage. So this is a tool that we use in my family, but it's free. There are other tools in Canada too, and ones in the States, and ones that are sort of all over the world, North American, and I'll go over what those tools are. But they're all based on the same premise of facilitating a way to talk about what's going on in your home, both medically and personally, in a way that everyone can have an ongoing conversation in the same room without actually being in the same room. So, for example, when you think, to use the example of kids with disabilities, for example, who are in school, the school world for them is completely separate from the home world, is completely separate from the hospital visit world and the medical professionals. And all of these domains happen very separately. But say you've got somebody coming in that you've hired to help after school. And this person doesn't know what happened at school that day. That person doesn't know that there's been a medication change of a seizure medication. That person doesn't know anything unless you remember to tell them all of these details. In this model, the teacher, the after-school helper, the home care nurse, the grandmother, the neighbor, the mom's best friend, because that's the mom's support, the dad, of course, extended family who are involved in this child's life, all can come in this secure network and know if the child had a good day at school, has a neurology appointment coming up with an overnight sleep study, and that the family is going to need a dinner delivered that night, And they'll also know that the child had a swimming lesson and it went great, because you're going to post pictures of that here. This idea of mixing medical, clinical supports with personal information of daily life and keeping an ongoing record of both the medical and the personal is what I want to talk about today. This is something I think that can be quite a powerful, helpful tool in sharing the care. So beginning to look here at ties, and Care Relay is another Canadian tool. It looks very similar to this when you open it. ALSCA is another American tool, again, very similar. But if you look at that top toolbar, so this is our son's, this is a screenshot from our son's personal network, his ties network. And this ties network actually supports the face-to-face contacts that we all have. This is quite an old screenshot, but it's still, it's fine. I had it in my file, so I'm using it. So that's my son on the right. That's Nicholas. He has lots of network supporters because he lives in a long-term care home, a small home nearby where we live. And so all of his paid caregivers, his nurses, are part of this support network, as is our extended family. So the care
A real quick
wall,
question on this about communicating within ties from Sheena. She asks, how are individuals updated? Do they have to log on to ties, or are emails sent out once there are updates?
So you can set how often you want messages and updates from ties coming into your email box. You can get all of the ties updates in your email box immediately. So you could get an alert in your email saying, Zachary just posted an update in ties, and then you can click and enter the site. Or you can get them daily, weekly, monthly, or never. So you can set how many alerts you want. Our GP is part of this network, and he has it set at never, because he was getting notices when Nicholas got a new hockey jersey, or his soccer team won, or he went to the park. Like, he didn't want that information. He wants to check in when we're at an appointment with him, and he can look at a glance to see how Nick's doing. Is he getting back into his daily life after a surgery, for example? At a glance, he can see Nick's daily life here. He can also private message, and we can message back and forth to send images of skin stuff, like a skin rash, and he can send the prescription right to ties and post it, so his nurses have the written orders for a medication in ties. So it can function to bridge medical help with the family and personal relationships. For somebody very medically complex like my son, it's really helpful because his medical needs and his medical, the time that it takes in his life for medical professionals to be hands-on involved is really a lot. So the medical stuff is as important as the personal stuff, and it's all his life. It's not chopped up into little separate pieces. It's all his life. So this is a snapshot of his life.
Donna, just a couple more questions from Erica about ties. She wants to know, is there an app for ties? And then I think you just answered this other question. Network participants can choose themselves how often they get email updates?
Yes, they can.
Okay.
It's all in the profile settings when you first start up with it. Yes, there is an app, and it's also online. Like it's web, whatever. I don't know. I don't use the app. I use it on my laptop, whatever you call that. And then on that top toolbar, you'll see files. So there's a virtual filing cabinet, and you can set who's allowed to view. So as an example, Nicholas had a very angry rash in his groin. I don't want my sister to see that, or anybody except the doctor and his nursing staff. So if you tried to view that file and you didn't have permission to see it, it would not appear on your screen. So, and I'm seeing somebody else has a question.
Andrea has a question. Does the information get shared to anyone outside your network?
No, it's completely secure. And so if you wanted someone to know and to be there, you would have to invite them to the network, and it's password encoded, and it is bank grade security. So it's very highly secure and obviously not Google searchable. It's completely private. And some of these other similar online care coordination tools are exactly like this. And some of them have added features and have a small fee. None of them are very expensive. Ties is free, but the other ones are very, very reasonable, and they come with added features as well. Special deals you can get on incontinence products, and they have marketing partners. So they're all different, and I encourage you to have a look at a variety if you're thinking of using one of these. And have a look, do your shopping. The calendar feature is really important because both medical appointments and symptom tracking can be used as symptom tracking. So you could put, 2-minute seizure on August 27th or whatever. And you can also use it to ask for help. If you want somebody to come with you to do banking, grocery shopping, whatever, a fun outing, you need a ride somewhere, you can use the calendar. And then there's also this feature where you can post a request. And of course, you can private message people as well, or group message people.
Donna, Erica's asking, is it user-friendly? Would you consider Ties compared to others relatively user-friendly in terms of ability to learn quickly how to do it?
Yeah, it's very intuitive. It is a lot like the CareWall looks like Facebook. Mm-hmm. So if people are used to using Facebook, you'll get the CareWall right away. The calendar can also be merged with your personal calendar, which is super helpful. And dropping files into the filing cabinet, it's well designed. It's got add a file, click that. And then it's like if you wanted to do an attachment on an email, it works like that. So, and again, I've done a lot of looking around at a wide variety of these tools that are in the marketplace, and they're all very user friendly. You don't have to be tech savvy to use these. What you do have to do is you have to be quite disciplined about using them when you decide to use it. So I'll tell you what I mean by that. When we started in my family with one of these tools, I thought, oh God, this is so much work. It's one more thing I have to do. I don't want to do a profile. I don't want to learn what it means to what do you mean? Set the daily, weekly, monthly alerts. Like, it's just when you're very busy at home, learning anything new is a bit of a pain in the neck. But when I discovered that how much easier my life was when I told everybody that I wasn't going to phone them, I was not going to email them separately. If they wanted to know anything about Nicholas or care in our family and helping us out, they had to go to this site. I was not going to use any other way of letting people know.
And add to that, Donna, I think that's so important because we've talked all of our previous 3 sessions about making care a part of our integrated life. And what you're saying sounds like if we don't have an integrated platform, like we would in the workplace, like we would never go to a workplace and not have a calendar function to make it legitimate. And did you get more control when you told other people, like, this is the platform I'm using, you all need to adjust to mine?
Oh, absolutely. Like, one little story to illustrate how much easier it was. It was like when my mother said she never needed a dryer. Why would I need a dryer when I can hang the laundry out on the line? And then she got one, of course. And then she said, oh my God, this is so fantastic. And it's a bit like that. But to illustrate it, Nicholas has many caregivers, for example, and they were all part-time. So they would come in, if they were doing a once-a-week shift, they would come in to our house, and they would assume that everything was the same as it was last week. And I had a whiteboard in Nicholas's room, and I would say, attention, alert, new dose of morphine, important. There was a chart with a pen and a book that they had to write down everything, including signing, giving meds and everything. They still didn't read it. They walked into the room and said, hey, buddy, how you doing? What's new? They'd get into a conversation. They would not read my signs, and the wrong med would be given. And I was just pulling my hair out. How can I get through to these people? I realized that anybody sort of like under 35, you have to give them a message on their phone. If a message comes through on their phone, they'll read it. They don't read a written word in the bedroom of the kid, you know?
That's a great example of getting buy-in from family and from friends. Terrence, Donna, asks, how did you get buy-in from providers like GPs, nurses, coordinators, and organizations to use the platform?
Well, that took some advocacy. It does help that this particular platform is owned by a healthcare provider, a home nursing agency called St. Elizabeth Healthcare, or SE Health. And so I think what you want to do is you want to talk about the data security. You want to say that it's HIPAA compliant, which is the words that you use that are buzzwords in the medical professional community that mean this has the data security that makes storing medical records safe. People have to enter this network using their email. Some medical professionals don't want to give their email, but we got around it by saying there's only one person who's ever going to use that email. There's only one person from our whole circle of care here that is ever going to message you. You're never going to get multiple messages from multiple people. There's one point of contact. So it was a sit down and a negotiating conversation. Please use this. We need you to use this because we have a medically complex person, and we need to be able to contact you because there's so much healthcare going on at home. And, and this is going to be very handy. Now, the other thing to keep in mind is that we live in the midst of a pandemic right now. And telehealth is the way that everybody's going today. So there's a billing code for doctors to participate in online care networks like this now. It's part of sort of a good standard of care in the community in using telehealth securely. So I would suggest that you do a lot of research into the security of whatever platform that you're interested in using. Sit down, have a conversation with your providers and say that you'd like to create a circle of care. And you'll need to reassure family members as well that this is highly secure. People don't want to come onto a new, what they see as a social media platform about private matters unless they have a lot of assurance that it's totally private. So I would say do a deep dive into the website of whatever platform that you're interested in exploring and look for everything that is relates to security. And all of these sites have, got questions? Click here. Here's the email for the company that operates these platforms, and ask them. If you get questions from your providers or your family members and say, oh, I'm a little worried about this or that, ask the company, how can I reassure these people that this platform is safe for them to use about very private matters?
I think those are such good suggestions and ways to advocate. And I would imagine from your experiences that given the complexity of care that many of our participants today might also be experiencing, you make this incredible point that, care respects no boundaries. It doesn't, it's not just a medically complex. If you have a medically complex child or situation, as you say, that renders itself in all aspects of one's life. And you've talked a lot, Donna, about, providers talking about the importance of family-centered care. To me, this is an example of, is there buy-in on this? Because This is the perfect embodiment.
Put your money
of
where your mouth is. And it also puts the caregiver in charge because of course, the person who is receiving the care can also be part of this if they're able and they want to. So it is a conversation about consensus building. If you're caring for someone who is not interested in becoming an active member of an online care network, like my mom, we had a Ties network for her too, and she wasn't interested in participating. But my sister and I, we were able to get the daily reports from her personal support workers who would come in, and they would say, your mom had a good day, or your mom was really in a rotten mood and she didn't eat anything. We think she might have a UTI. Better get that checked out. It is a conversation amongst people who are interacting with your loved one that you might have to struggle to find out what happened today. And this makes it a lot easier in that respect, so that you can have a sense of project management, of leadership in the whole team. So this isn't about giving away control. This is about taking control.
Can you talk a little bit more about this idea of project management? Because it's an interesting way of talking about caregiving.
I always see caregiving as a project, and it as requiring project management, because it really is. It's a whole set of tasks that are born from the combination of love and necessity. And if you decide that want and seek the help of others, then you're already team building. And you can't let the team just sort of hope for the best, and without knowing that, like, say your sister is going to go see your mom on Saturday, because if you don't know that, you might show up at the same time and nobody shows up Wednesday, Thursday, Friday. So it's about organizing and it's about management. And I think, so often caregiver guilt comes from the fact that if I didn't do it myself, it's not going to be done well. It won't be done at all. And, sometimes we get burned, and that is true. But I think, when we were preparing for this, Zachary, you and I were talking about finding out what people can give and what they want to give, and helping sort of orchestrate what we would call a clean transaction of care, which is not overwhelming. I'm doing something that I'm naturally good at. I'm doing something to help out that I naturally like to do, and that I know is helpful. I know it is.